Yashu Khatri is in New Delhi. She and her husband took their two young children, 6 and 2 years old, to India because of a family crisis we're going to hear about. And of course, because now there is a commercial ban in effect on, there's a ban on commercial and private flights out of India and Pakistan back to Canada, they are stuck. So, Yashu's story. Yashu, good morning. There you are in New Delhi, and it is a pleasure to welcome you to our program. Hello.
It's an honor to speak to you, Heather. Thank you. Hello, good morning.
Well, listen, first things first, how are you? How are you and your husband and children in terms of your health and safety?
In terms of our health and safety, we are safe. By God's grace, we are very fine. But there's a hell lot of uncertainty going around in India. And since, you know, the cases are going up day by day, so every day is a new day, and we just pass each day. And thank God that we are safe.
I bet so much uncertainty, so much fear, so much death and illness and just crisis around you. Number one, where are you staying? Where am I speaking to you? A family residence or a hotel or?
It's actually my father-in-law. Okay. He went through a brain clot surgery, and I came to India for him. So he's as at my residence, getting cured, being fine, and I don't want him, like, people coming to meet him and greet him, and I don't want him to catch COVID, so I'm staying at my mother's place with my whole family. So there's only a nurse and a doctor at my residence, and I'm staying at my mother's because the COVID is spreading like mad, like crazy, and you cannot make a patient go through all this. So it's better to stay away from him, give him less of infections, and so that he cures easily and nicely and early.
So that I mentioned that your family traveled to New Delhi because of a family crisis, and that was the health of your father-in-law. Is that the story there?
Yes, actually, he had a brain clot, and had to go undergo a surgery. So me and my family, we were informed that he's not going to make it anymore. So we rushed to India because I wanted to meet him so badly. So me, my husband, and my two kids, we came here on 14th of April, like at midnight. And then I saw him, and he recovered, and he came out of the hospital. But the ban happened, and I cannot get back to Canada from then.
And we're going to talk about that in a second. That's interesting. You hadn't met your father-in-law before. But even though you wanted to meet him so desperately, as you said, had there been discussions when you were here in Canada as a family, Yashu, about, you know, the risks of traveling to India? Because we knew back in April how bad things were getting.
Things were getting very bad, Heather, and I swear I don't want to put my risk or my family to exposure to such an environment, because I know that what if we don't make it? But the report that I was getting from the doctor, like from his doctor in AIMS, All India Medical Institute, were all about that he's not going to make it. He's not going to survive more than 2 days, so you need to come as soon as possible. So that was a family emergency that I had to come, because he has nobody apart from us. So he was all alone. So I had literally had no choice.
So you felt the reasons for going outweighed the possible risks to you and your family in that decision. That's difficult.
Because he had nobody. Mm-hmm. There's nobody to take care. There's nobody to serve him food. And if he's going through a medical surgery where he might not make it, I cannot lose that opportunity. I'm so sorry.
Yes. So there you are, and you land, and this is mid-April. You're landing, and the situation is worsening around you. You sent us some video, Yashu, that I want to show now. Your brother captured this.
Yeah.
Give us sort of the picture of what you're seeing as COVID sort of moves through the neighborhoods and the areas around where you are in New Delhi. These are people lined up with oxygen.
Cylinders, yeah. Actually, a few of my relatives were not doing well, and they needed oxygen cylinders. Like, their oxygen went from 88 to 70 and then to 45. So my brother, he rushed to the hospital or to nearby oxygen generator plants to get the oxygen refilled in the cylinders, and he made a video. People are lining close to 32 hours to 40 hours just to get their cylinders refilled, which is it's an absurd thing, because it's not healthy for any human to go through these circumstances during a pandemic and roaming around the streets. You can get coronavirus too. So I don't know. He had the courage to do that, but I honestly didn't. But hats off to him.
So your some of your family members exposed to coronavirus, dealing with coronavirus. You said you're safe with your children.
I lost them.
Sorry, go ahead.
I'm so sorry. I lost my family members, like one of my aunt, one of my uncle, one of my distant relative. I lost close to 10 to 15 people that I know personally due to corona, and it is all due to less of medications or less of oxygen cylinders. And it is not the government's fault as well, like you can say, because we are 1.35 billion people. Even if 0.5% get infected, they don't. No country is ready for such a pandemic, right?
Right, right. So you, in the midst of all of this, I understand you and your husband
Yeah.
were vaccinated earlier this month. Now, in the midst of all of this going on around you, does that give you a little bit of a measure? You're feeling some protection?
We, yeah, we did, but we need to get the second dose, right?
Right.
And I got vaccinated a day before yesterday. There were no slots open for people 18 above to 45. It opened day before yesterday, and I got myself vaccinated and my husband. But again, I've known people who get vaccinated and still there are no more. So it does give me a sense of security, but again, it doesn't, because it's all in the destiny. And I just feel and wish to get back to my country where I can get the healthcare, get the best, you can say, taken care by the government or the hospitals at the right time. It is not something that I should feel that I'm lagged here.
Yes, we're looking at pictures of you and your husband getting your shot right now. But here you
Yeah.
are, you
Yeah.
expressing there wanting to come home. And here is the situation, of course, with no flights out of India
Yeah.
into Canada.
No flights.
What
Yeah,
will
total
you
ban.
do if you're stranded there for the foreseeable future?
I have no clue, Heather, because I have been trying flights via Turkey, via Istanbul, via Mexico. Like I'm trying to get to Canada through the third country thing. But again, going to Mexico, and then if I expose my kids to the COVID there, no one's answerable, and I'm gonna be in a huge mess if I tested positive, because you never know the people you're flying in the airplane. You have no clue. But again, we are trying ways to get to Canada, but as of now, there's no, you can say, I don't know how I'll get there. I'm just clueless.
There's no way. It's such a delicate situation. So that third party, that
Yeah.
third country, you'd stop and wait and do all the things that the government is
Yeah.
saying you'd have to do in that third country. But I mean, I'm sure that you would appreciate there's a high degree of support for the travel ban here and for closing the borders to prevent any of the virus that is having such a major impact in India from coming into the country and keeping people here safe as well.
I know, I agree to the fact, but what I can say is we can get the RCPR test done. We can come and do the hotel quarantine thing doing, and then we can again stay at our respective places for 14 days. If any of that goes wrong, then we are answerable. But at least give us a chance, because being here, I swear every night I sleep, I don't think I'll be able to make it tomorrow morning, because I've heard such cases. It is not that I'm that weak or I don't have the immunity to fight back the COVID. It is just that the scenario or the cases here are going wild. And I have known cases who slept at 8 after their dinner, and the next morning they didn't wake up. So I don't know which kind of COVID is affecting people here, what is happening, but I am literally on my nerves to get back to Canada, and I request the Canadian government to please take this back as soon as possible.
Yashu, it is such a difficult situation all around for all of the people there and all of the people listening to the story, for sure. We're going to keep in touch with you and follow the story. I've been showing beautiful pictures of your boys, and I want to conclude on that. I mean, 2 and 6, and in the middle of all of this as well.
Yeah.
I mean, how are you keeping them safe, and how are you keeping them, sort of maybe unaware of what's going on, not fearful? How are you dealing with your kids, with your children?
Heather, with in Canada, I used to take them to the front yards or the backyards, or just for a walk, or to the park. But in India, the houses are not semi-detached or detached. They're like just like townhouses, right? Built next to each other. And I have 3 cases in front of my building, 4 cases of COVID cases in next of my building, and 1 on the top floor of my building. I cannot even tell them to go to the gate to open if somebody comes in. They are locked in this very room. Like I'm being here for 20 days, and all I can do is give them phone or give them iPads to keep them occupied, because no toy shops are open, no stationery, nothing. So for them, it's just me and my husband and the rest of the family entertaining them. But we can't do much, because at the end of the day, they're kids. They want to move around. They want to play around, and it's summer here. And people in India, they have a fear that if they put on the air conditioning on or something, the COVID's gonna affect more badly.
Right.
So no air conditioners, no fans, nothing. It's just that you are your kids and in hot, humid summer weather, and you have nothing to do. Just pray to get back to Canada. So
Yes, get to
I'm
Canada.
sorry, but I don't have, yeah, I don't have anything else to say. Oh
No,
God.
except that I wonder, all of this that you're in, this unfortunate
Yeah,
crisis, this
yeah,
unfortunate timing,
yeah.
how do you view the decision initially to go there for your father-in-law? Still think it was the good one to make?
Heather, I don't know how to put it across, but it was humanity in me. I cannot lose his side. If he had been no more, I couldn't afford to regret for the rest of the life that I couldn't see him. So there's everything beyond the fact that I wouldn't have family in India. So I cannot put it in words whether it was wise or not, because I was risking my kid's life and my husband and my own too. So it was not something that I willingly had to do, but I literally had no choice. Like he's my father. I cannot afford to be the fact that I wouldn't be there to do your last rites or something of that. Thank God that it didn't happen, but I would have regretted. So I know I'm still regretting that my kids are here stuck in this way, stranded in India. But it was necessary. I'm seriously sorry if I cannot put it through, but
No,
it
no.
was
You've
necessary.
made it very clear, and we see your humanity
Yeah.
with every answer.
Yeah.
Yashu, as I said, we'll keep in touch with you. We hope for the very best for you and your family, your beautiful
Yeah.
family we're looking at again. Thank you for sharing your story with
Yeah.
us this morning. I very much appreciate it.
Thank you. Thank you.
Okay, you be well
Thank
and safe. Yashu Khatri in New Delhi with us this morning.